In this module, we'll discuss the role of the discharge volunteer. Our patients have just been blessed by visiting Clinic with a Heart, but that doesn't necessarily mean it was an easy experience. Imagine if you don't have a car trying to get to the clinic, or if you don't speak English trying to comprehend all that is going on. Imagine not feeling well and being in a full waiting room. The discharge volunteer plays a key role in helping our patients to understand the visit they just had and what comes next. You will be the patient's final stop at Clinic with a Heart. Before beginning the discharge process with the patient, review the documents in the file. Get an idea of why they came and what happened during the exam, prescriptions, their demographic background, and any other information that will be pertinent. All these forms offer you the information you need to pull the visit together for the patient. The color of the patient chart also tells a story. A manila folder is an urgent care patient, subject to regular visit limits. They may be seen for medical 3 times in 12 months or for vision once every 2 years. A green folder is a patient who has been admitted to our hypertension clinic. The medical visit limit has been lifted for these patients. The hypertension clinic is our only chronic care clinic at this time. Orange folders are for patients who have exhibited poor behavior during a clinic. The operations coordinator will have given them a letter, and a copy of the letter is in the chart, stating what the difficult behavior was. These patients have been informed that if they continue to exhibit poor behavior, they may be banned from the clinic. You should not see a red folder. The red folders are for patients who have been banned from the clinic, so we should not admit them when they come to the clinic. Before working on the referral with the patient, verify that they have signed the consent to treat section of the exam form. If they have not, please complete this section with them. If a prescription has been written, they should be kept with the medical record. Look for a red smiley face stamp on each prescription. The stamp indicates that the prescription has been approved by our clinic pharmacist. The red smiley face stamp also lets you know that the patient has been in our clinic pharmacy and has been counseled regarding their medication. There should be a copy of the prescription in the patient's medical record. The smiley face stamp also lets the pharmacist at any Russ's or Super Saver know that the prescription has been approved for filling. Help the patient understand that the cost of the prescription is paid for by the sponsors of Clinic with a Heart if filled at these participating pharmacies. Make sure that this is checked on the discharge worksheet. Check with the patient to see if they have any questions about the prescription or the medications, and give the prescription to the patient. Another primary goal of Clinic with a Heart is to help a patient find a permanent medical home if they do not have one. If the patient is receiving general assistance or Medicaid, has a primary care physician, or has been seen at Blue Stem Health, formerly known as People's Health Center, then they have a medical home. We can still see the patient, but we will refer them back to their medical home for prescription refills or follow-up care. Please note that conversation on the notes section of the discharge worksheet. The health history and demographic forms can give you information on the patient's medical home status. If a patient does not have a medical home, please use the discharge worksheet and refer the patient to the appropriate resource for assistance. We do not refer to specific medical homes, but rather to agencies who will assist the patient find the best solution for their circumstances. Those agencies will do a financial screening with the patient and determine if they qualify for programs like general assistance, Medicare, or Medicaid. Advanced Medical Imaging donates imaging services for patients of Clinic with a Heart. We want to be good stewards of this donation. Any imaging services ordered should be for urgent needs only. If an X-ray has been ordered by the medical provider, he or she must sign the AMI referral form. Instruct the patient to call AMI on the next day to make an appointment. The exam is free to the patient. Once the patient has completed the procedure, have them call Clinic with a Heart offices to obtain their results. The results will be faxed to Clinic with a Heart, and the patient will be given a fast-track visit to the clinic to get the results from a medical provider. Please be sure the referral coordinator is aware of these referrals. If a referral is being made, be sure the patient understands their responsibility in scheduling any follow-up appointments. Under the Notes section of the back of the discharge referral sheet, document instructions. The discharge volunteer and patient both sign the sheet once it has been reviewed. Make a copy of the discharge referral sheet for the file and give the original to the patient. At the end of the visit, ask the patient how things went and if they have any questions. Explain that they may be receiving a follow-up phone call to see how things are going. If the team you are volunteering on provides goodie bags to the patient, please make sure they get one at the end of their visit. Take the patient chart to the volunteer check-in area for scanning. Our patients have many complex issues. If you need assistance in discharge, please feel free to contact a referral coordinator or your team leader.